Hi, it's Christina with the Sisyphean Journal, and today I'm going to talk about the anesthesia at Kermit Gosnell's clinic. And what kind of prompted this was I've started watching a YouTube channel about anesthesia. And of course, the more you learn about how something is done properly, the more it's like getting whacked upside the head with an 800-pound wet tuna to see how bad things are in abortion clinics. I've talked a lot about the horrible anesthesia practices, but the best documented and probably the worst handling of anesthesia, even worse than Joe Bills Reynolds with his janitor administering anesthesia, even worse than Scott Barrett administering general anesthesia by just overdosing his patients on lidocaine so that they lose consciousness, is how Kermit Gosnell handled things. He is the creme de la creme of bad anesthesia. And of course, those of you familiar with the Gosnell case know that it's these horrible anesthesia procedures that led to the death of Karnamaya Mungar. So, looking through the grand jury report, we can look at the specifics. And let's look at the people that Gosnell had administering anesthesia in his clinic. Okay, Latasha Lewis. She worked for about 8 years at the clinic between 2000 and the day of the raid, which was 2010. She took off a year to work someplace else and took maternity leave twice. She had completed an 8-month program at Thompson Institute, which was a vocational training institution, but she didn't get any kind of certification or a license. She was not trained to perform ultrasounds, administer medication, or deliver babies, so she did all of these tasks at the clinic, and among her other duties, she administered anesthesia and attended to patients in recovery. And except for times when she was actively assisting Gosnell, she performed these duties when he was off-site. Tina Baldwin worked continuously at the clinic from February 2001 until the raid in 2010. She also had attended the Thompson Institute, but wasn't certified as a medical assistant until 2009, whereupon she very quickly started looking for another job. She performed the same duties as Latasha Lewis until she was moved to the front desk in 2005, and she admitted that she knew she was not supposed to administer IV medications, but did so anyway. Karima Cross worked at the clinic from August of 2005 until the raid, and she performed the same duties as Latasha Lewis and Tina Baldwin, and the grand jury doesn't mention any training for her. Ashley Baldwin was Tina Baldwin's daughter. She was a 15-year-old high school sophomore when she was hired to work at the clinic part-time in 2006. She wound up working up to 50 hours a week and performing the same duties as all the other employees. Sherry West was hired in October of 2008 and had no training and performed the same tasks as the other employees, including anesthesia, and she assisted in the fatal sedation of Karnamaya Mungar. We had Marcella Stanley Chong. She said that her training consisted of Gosnell describing what he typically did and then reading a chart he had posted in a cabinet. I'm going to quote the grand jury report. She was so uncomfortable medicating patients, she said, that she didn't sleep at night. She knew that if she made even a small error, I can kill this lady, and I'm not jail material. One night in 2002, when she found herself alone with 15 patients, she refused Gosnell's directives to medicate them. She made an excuse, went to her car, and drove away, never to return. Chung immediately filed a complaint with the Department of State, but the department never acted on it. Kudos to Marcella Stanley Chong, and if the state had listened to her, she would have been the true hero of this story. Pearl Gosnell was Gosnell's wife. She was licensed as a cosmetologist. She claimed to have attended Lyon's Technical Institute to obtain certification to take temperatures and blood pressure. She was Gosnell's sole assistant on Sundays when he performed the abortions so late in the pregnancy that he didn't dare do them in front of these other employees. And then we have Linda Williams. She knew Gosnell from Atlantic Women's Medical Services, which is the National Abortion Federation member clinic where Gosnell worked on Wednesdays, starting late abortions that he would finish at his clinic. So keep that in mind. These patients that are being doped up by these untrained people, at least 6 of them, including the mother of baby boy A, went to a National Abortion Federation cream of the crop clinic for their abortions and wound up in Gosnell's House of Horrors amid the fleas and the cat feces, being doped half to death by these people I just described. So Linda Williams had no formal training and performed the same tasks as the others. Other staff said that Williams would give patients repeated doses of Cytotec to induce labor, which would cause more pain, which would kind of bring them up out of their stupor, and then she'd administer more drugs to knock them out. She is the one who administered the Demerol, promethazine, and diazepam, resulting in Carnemia Mongar's death. Interestingly enough, Randy Hutchins, who the grand jury refers to as a licensed medical provider, was at the facility. So, it's interesting that there were people who did have medical training who were there. They were physically present. But these untrained people were the ones that were administering the anesthesia. So what was the routine? Again, I'm going to quote the grand jury report. Drugs were administered without regard to a patient's weight, medical condition, potential risk factors, or any other relevant factors that physicians need to weigh in determining appropriate medications. Missed a letter D there. Gosnell ordered his untrained and inexperienced staff to administer drugs to patients even when they protested, as 16-year-old Ashley Baldwin did when they were not qualified. So Ashley was hired when she was 15, started administering the drugs when she was 16. And that's when she created the anesthesia chart. You follow the link and you can actually see a picture of the anesthesia chart created by a 16-year-old girl for all these people to follow for anesthetizing patients in this clinic. So patients began to arrive at the facility about noon and were anesthetized prior to Gosnell's arrival, which was typically at 8 p.m. Again, to quote the grand jury report, Gosnell disliked it when workers disturbed him by calling for medication advice. According to Lewis, you had to rely on your own. If you felt they were in pain and you wanted to administer medication, you would just administer the medication yourself. Now, as bad as it is that the guidance they had on medication was this 16-year-old girl's cheat sheet that she drew up after getting trained for about 20 minutes, Linda Williams was even worse, as was Sherry West. Other staff indicated that Williams and West improvised their own drug cocktails. Again, quoting the grand jury report. Other staff members repeatedly reported this dangerous practice to Gosnell, yet he continued to give Williams responsibility for drugging his second trimester patients. Cross warned Gosnell in 2008 that Williams gave too much medication, but Gosnell didn't care what she did. Cross would tell Williams that she was giving too much medication. Williams would respond, "Well, that is what Dr. Gosnell told me to give." So, first trimester patients were offered a list of different types of sedation and their prices, and then could choose the sedation they wanted. So the local, which was not a local is like when you go to the dentist and they inject the lidocaine to numb you, or if you're getting a wart removed, the doctor might administer a local. She called it local, or rather Gosnell called it local, which was 10 milligrams nalbuphine and 12.5 milligrams promethazine. Heavy was 50 milligrams Demerol, 12.5 milligrams promethazine, and 5 milligrams diazepam. For some reason, I have an extra period in there. Twilight was 75 milligrams of Demerol, 12.5 milligrams of promethazine, and 7.5 milligrams of diazepam. And then Custom was 25 milligrams Demerol, 12.5 milligrams of promethazine, and 10 milligrams of diazepam. And then Latasha Lewis told the grand jury that this is how patients were presented with their anesthesia choices. This is what she said they'd tell the patients. You can pick which anesthesia you want to receive, whether you want to be up, half asleep, if you want to be knocked out, and it's additional to your procedure. But local anesthesia is included in the smaller cases, and custom anesthesia, which is the highest, to be put to sleep in bigger cases. Now, actual local anesthesia, where you just inject a little bit of lidocaine, that is, in real practice, the typical first trimester abortion anesthesia. They just numb the cervix and go about their business. Now, the anesthesia for surgery form presented options and suggested, and this is verbatim from the form, and I have, if you follow the link to the companion post, I have Karnamaya Mongar's anesthesia form, and you can read it. It will probably be best to pay the extra money and be more comfortable if some of the following conditions are true for you. 1. The decision to have the procedure is a difficult decision. 2. Medication is usually necessary for your menstrual cramps. 3. Your decision has been forced by your parents or partner. The grand jury does pick up on the fact that that means that Gosnell was perfectly willing to perform forced abortions. And or 4, your family members or friends don't like pain. Well, first of all, who likes pain, and your family members or friends don't like pain? Like, what? And then I'm going to share with you the descriptions that were given to patients. So the $150 option. Most women who choose custom sleep want to feel absolutely no cramps or pain during their procedure. A needle with an anti-clotting medication is inserted prior to the procedure, and sedation is repeatedly administered until the patient is comfortable throughout the procedure. $90. Most women who choose twilight sleep want to feel very few or very slight cramps during their procedure. And then the $50 option. Most women who choose heavy sedation want to feel slight to moderate cramps during their procedure. So staff testified that when patients arrived, they'd be given Cytotec to induce labor and Restoril to calm their nerves at the front desk. And then they'd be taken to the recovery room where they'd be undressed from the waist down and covered with a blanket. Once an IV was in place, they'd be given the Twilight, the 75 milligrams of Demerol, 12.5 milligrams of promethazine, and 7.5 milligrams of diazepam to put them to sleep and make them comfortable. Patients typically would wake up 3 or 4 times throughout the day, and they'd be given more drugs to keep them under. Women might remain in this casually sedated state for 8 or 9 hours in labor. Remember, they're being given the Cytotec to induce labor, and they're being doped up enough that they're not waking up while they're in labor. Think about how much drugs that is. Women would remain in this casually sedated state for 8 or 9 hours in labor until they either expelled their babies or Gosnell arrived to perform abortions on them. And if Gosnell performed an abortion, he would give the woman even more medication. And staff would sedate first trimester abortion patients into unconsciousness at Gosnell's insistence if they would get out of hand. Staff typically did not document when they administered medications, and sometimes another employee would come along shortly thereafter and give the patient another dose because nobody was keeping track. No monitoring equipment was used, and typically the only time the staff was in the recovery room with these patients was either to set up a new patient, or about once an hour they'd come through and check to see if anybody was moaning, and if she was, they'd give her more drugs. What about the equipment? The clinic had 1 defibrillator, 1 EKG machine, and 1 pulse oximeter, and they had all been broken for years as of the February 2010 raid. And there was only 1 blood pressure cuff in the clinic. The only equipment to suction an airway was the suction machine used for the abortions, and there was no crash cart of medications in either the procedure room or the recovery room. So let's look at the end result of all this, shall we? Karnamaya Mongar. She was a Bhutanese refugee who spoke no English, and she came to the clinic on November 19th of 2009 for the final step of her 2-day abortion procedure. She was about 19 weeks pregnant. She was less than 5 feet tall and weighed only 110 pounds. Not surprising for somebody who had grown up in Bhutan and lived for 20 years in a refugee camp. Karnamaya's daughter, Yashada Gaurang, was allowed to stay in the recovery room by her mother's recliner. Now, between 3:30 and 8 p.m., staff administered 5 or 6 doses of Cytotec, which they would put in here. That's called buccally, between the gum and the cheek, to stimulate labor. There was no monitoring equipment because, of course, there was no monitoring equipment, unless you count the broken stuff. And Yashada noticed that staff injected drugs into her mother's IV several times. At 8 o'clock, staff told Yashada that Gosnell would be arriving soon to do her mother's abortion, so she had to go out to the waiting room. Yashada tried to wake her mother before she left, but staff told her not to because the medication was supposed to keep her asleep. In the investigation later, staff said that Karnamaya was moaning in pain as they took her to the procedure room and put her on the table. Williams then administered the custom dose of medication, again, 75 milligrams Demerol, 12.5 milligrams of promethazine, and 10 milligrams of diazepam to stop her from moaning and moving. Once Karnamaya became still and quiet, Williams left the room. So there is this patient, heavily sedated and completely unsupervised for the 10 or 15 minutes before Gosnell showed up to do the abortion. Now, there's a lot of conflicting testimony about what happened next, but at some point, Linda Williams realized that Karnamaya Mongar wasn't breathing. Sherry West said that Williams came out of the procedure room yelling for help. West found Gosnell performing what looked like CPR. Now, remember I said that they weren't licensed, but at least they were trained as doctors? One of them was Eileen O'Neill. She wasn't licensed, but she had been trained as a physician. Everybody else is doping these women. We had somebody who had a physician's training. She was in the building. Only then does somebody go and get her. So Williams went and fetched her. O'Neill later said that Karnamaya seemed to be already dead when she arrived in the procedure room, but she took over CPR because Gosnell wasn't performing it properly. Surprise, surprise, we've had deaths because nobody freaking knows how to do CPR. Your teenage babysitter probably knows how to perform CPR better than a lot of abortion clinic staff. Gosnell went to the 3rd floor to get the disused crash cart. O'Neill tried to use a defibrillator, but it didn't work. Well, they'd known for years the bloody thing was broken. Meanwhile, Gosnell came down with a cart and he went through the medications and seemed really happy that they weren't expired, but he didn't use any of them to try to save Karnamaya Mongar. And O'Neill testified that she wanted to administer Narcan to revive Karnamaya, but Gosnell told her, don't bother, it won't work on Demerol, which isn't true. O'Neill came away with the impression that the reason Gosnell had fetched a crash cart was to stage the room for when paramedics arrived, because it was against the law to have sedated patients without a nearby crash cart. After the scene was staged, after 11 p.m., remember, this whole debacle started at about maybe a little bit after 8, a little bit after they shooed Karnamaya's daughter out to the waiting room. It's after 11 p.m. before somebody calls 911. Medics arrived to find that somebody had removed Karnamaya's IV. They had to start another IV to administer medications to them, and Gosnell was just standing around, not doing anything. Nobody told them about the massive amounts of drugs that had been administered to this tiny woman. Now, the medics worked to resuscitate Karnamaya and were able to get some faint cardiac function, but it took more than 15 minutes to get her out of the clinic and into the ambulance because the emergency door was gated and padlocked shut, and nobody knew where the key was, and the hallways were narrow, twisted, and cluttered. And again, I've seen this before. Oh, what was her name? I can picture her face, but I can't remember her name. We had the woman who died, and part of it was the abortion clinic was on the 3rd floor, and you couldn't lay a gurney flat in the elevator. They had to sit her up and stop performing CPR while they brought her down in the elevator, and she wound up dead. But the abortion lobby wants you to think that it's no big deal whether or not you can get a gurney through the halls. That's just cosmetic stuff that those mean old anti-choicers want you to have. Should be perfectly okay to have, boxes and bags and all kinds of crap all over the place in narrow hallways you can't get a gurney through. And, if the medics step in some cat crap, who cares? So, at any rate, Karnamaya was admitted to the ICU, but she had no neurological function, and they kept her on life support until the following evening when her family members all had had a chance to come to Philadelphia and say goodbye to her. So, in closing, I want to say that, to my knowledge, in spite of all these appalling practices, somehow Gosnell and his staff seem to only have managed to dope that one woman to death. That strikes me as unlikely. How could they have been playing Russian roulette for that many years without the gun going off? The grand jury report did also note that Gosnell's staff would put barely conscious patients in wheelchairs and shove them out the door to their companions' cars. Which, again, this is something abortion clinics seem to like to do. She can't walk, plunk her in a wheelchair, shove her out the door, chuck her into her loved one's car, and wash your hands of her. They did that to Sharon Hamplin and not Sophie McCoy, not Cynthia Dennard. Oh my gosh, I can't remember. The 18-year-old girl died New Year's Eve. But at any rate, I get the sneaking suspicion that it's entirely possible, if not likely, that one or more of those women died after leaving the premises, and that their deaths were either not adequately invested or they were covered up. And since Gosnell also ran a pill mill, it's entirely possible that a lot of his patients knew him through the pill mill, were known drug addicts, so when they died of a drug overdose, the assumption was that it was, them overdosing by doing drugs and not them being overdosed at an abortion clinic. I would love to see an investigation and find out how many bodies Gosnell actually did strew all over the place. We're never going to know. But, keep in mind, all of this was happening. Marcella Stanley Chong, remember I talked about her? She's like, somebody's going to get killed, I'm out of here. She warned the Department of State that ran the medical board, this is what this guy's doing. And they're like, yeah, whatever. The health department hadn't inspected the place in over a decade, and they've been getting complaints. They've been getting reports of abortions being done past viability, unsterilized instruments, all kinds of problems. And they're like, yeah, whatever, it's an abortion clinic. We don't want to look at it because if we look at it, we might have to close it, and that would be bad. Far better to have a Kermit Gosnell up and operating than for a woman to maybe have to travel a little bit further for somebody who actually has somebody other than a 16-year-old high school student drawing up their anesthesia guidelines. Welcome to abortion land, sunshine and unicorns.